Greetings to all. Thank you for returning to my channel. In our current segment, we shall delve into a critical diagnostic procedure known as the tilt test. This examination is particularly useful for individuals who have experienced symptoms such as dizziness or episodes of fainting. We will cover the mechanics of the tilt test, outline the steps involved in the procedure, and discuss the implications of the results. Whether you have an upcoming appointment for a tilt test or are simply interested in learning more, I invite you to stay with us for a comprehensive overview. The tilt test is a non-intrusive examination that requires the patient to lie on a specialized bed, which is then inclined to a 70-degree angle. Throughout this procedure, both the heart rate and blood pressure are closely monitored at various intervals. The objective of this test is to simulate conditions under which the patient may experience symptoms like dizziness or fainting, thereby enabling a thorough evaluation of the body's physiological response. The exam is recommended for patients with recurrent fainting in the absence of structural heart disease, for patients who have had a single episode of syncope during high-risk activities, to differentiate syncope associated with tonic-clonic movements from epilepsy, to evaluate unexplained falls, and to evaluate patients with frequent syncope associated with psychiatric disorders. In order to perform the exam, the patient should come fasting for at least 6 hours and bring a spare set of clothes. It is also necessary for the patient to come accompanied, as the exam can cause discomfort and dizziness. During the test, the patient will remain in an inclined position for approximately 40 minutes. Should it be necessary, the physician may administer specific medications to accelerate the heart rate, simulating the effects of physical exercise. Throughout this period, the physician will routinely inquire about the patient's well-being and ask if any symptoms such as dizziness or palpitations have emerged. If the examination proceeds without incident, the patient will not experience any symptoms and will be able to return home without any discomfort. On the other hand, if the test reveals abnormalities, the patient may experience symptoms like dizziness, nausea, or even fainting. As a precautionary measure, fasting is advised prior to the exam to mitigate the risk of aspiration should vomiting occur. Finally, it is important to emphasize that the tilt test is a safe and very important exam to identify the causes of dizziness and fainting in patients with a history of these symptoms. I hope it has been useful for you to understand what the tilt test is, what it is used for, and how it is performed. If you have symptoms such as recurrent dizziness or fainting, or if you engage in high-risk activities, it is important to seek medical advice and discuss the possibility of undergoing this exam. Share this video with your friends and family so that more people can understand about the tilt test and the importance of taking care of their health. And if you haven't already subscribed to our channel, be sure to do so to receive more important information about health and well-being. Thank you for watching.